Medical School, and that they were reserved for New Brunswick students. And with them setting up their own, it's sort of a satellite really, because Dalhousie will still be the school administering it, but they will be studying in New Brunswick. It has freed up a capacity at our medical school at Dalhousie. And we had previously in the budget, it's on page 13.7 for anybody who's following along and anybody that wants to see where we're at. 13.7 has a line item about the support for that program. I believe it is anyway, and again, I know you have your financial staff with you today too that can help. There is a single line item called physician training seats. And it was, by way of context, it's been $3,005,000, and it's now down for this coming year, 2010-11, it's gone from $3 million to $540,000. So, you know, there's a big question there about what's gone on. Or I know sometimes the funds have moved to another line item or some other way of showing it, but that's a precipitous drop, and I really want to know about your commitment to maintaining the program where the government of Nova Scotia gets contracts with medical students and asks them to stay in this province in return for this kind of support in paying their tuition. I think it's a win-win situation. I've mentioned before, and I'm not sure if it was here in the House, but I certainly have told others that in the 1950s my father signed just such a contract with the New Brunswick government, and we returned to live in Campbellton, New Brunswick for 6 years because he had a commitment. I think we stayed beyond the commitment time, but he was from New Brunswick and he gave time back to New Brunswick because he had help. So this is not a new idea. It's always been difficult to get a medical training. It's expensive and it takes many years, and young people need help to do that. So I wonder now if the minister is ready to talk about that program and the funding that's there.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. And I think there are a couple of things that I want to say. First of all, I want to say that the existing and the ongoing training seats at Dalhousie are not being changed by this budget. There are 161 existing seats, and as we go forward into this this coming year with the budget here, there will continue to be 161 training seats funded by our department. Now, having said that, that line item that the minister is referring to has seen a reduction, but it's related to research. And as I understand it, Mr. Chair, some time ago, quite a long time ago, the Department of Health provided a grant to Dalhousie for research, and this predates the RFPs, or the AFPs, I'm sorry, the AFPs, the alternate funding payment plans. And that's right. And so what happens is, under these plans now, there is a great deal of revenue allocated for research purposes. And my understanding is that because there was a duplication of payments for research, this was one of the items that was picked up in the expenditure management process. I think in grants, when grants were reviewed from the Department of Health by the expenditure management folks, they picked up the duplicate payments that were being made for research, and it was reduced accordingly, but no reduction in physician seats. 161 this year, 161 next year.
The Honourable Member for Halifax Clayton Park.
Thank you very much, Mr. Chair. That again, and this is always the fun of estimates. When you start to peel the onion, there's so many different things. Like that would have appeared to me to be the seats that we were talking about, which was where the government of Nova Scotia engages in a contract with an individual medical student to stay in Nova Scotia. So I want to go back to that. I also am interested in the research aspect that you raise, but I would like to go back and perhaps even while I'm speaking, you could look and see, is there any money in the budget for those contracts between the government of Nova Scotia and students that are in the process of getting their medical degree to stay in Nova Scotia? I'm thinking that the 161 students that you're talking about is just the subsidy we give to the school. And I may be wrong, but I'd love to have a further discussion on this. It was my understanding that although they pay something like $20,000 tuition a year, the actual cost, the incremental cost per student is about $65,000. So are we talking there about the general sponsorship of every seat without the contract tied to the individual in tuition support to bring them back to, to work in our province as physicians when they graduate, or to have them stay here when they graduate? So there might be two different things. One is just an overall subsidy of every single seat in the medical school. The other would be a contract to bring them, to tie them here essentially if they choose, those that choose that want to have tuition support from the government of Nova Scotia directly to pay their tuition and then stay in the province. So maybe you could clarify the 161, because my question's really about the 20 seats that have come free and the commitment that we had that was between 5 and 10 physician seats that were going to be contracted and supported by us so that people would stay in the province. So I need a clarification about those numbers.
The Honourable Minister of Health.
Well, thank you very much, Mr. Chair, and welcome to the chair. First of all, I want to go back to the previous question because I misspoke and I provided information that's not accurate. The reduction in that line item on page 13.7 is actually a reduction that relates to where the funding for physician training seats is coming from. And there's been a transfer from the Department of Health to the Department of Education for a certain number of seats. So that reflects that. It's not a transfer. Twice. Okay. So actually, it's not a transfer. We were paying for seats twice. We were both, so seats were being paid for both through the funding formula in the Department of Education and the Department of Health. There, fine, yeah, got that. So that's the first thing to let you know. The second question you had is about residence positions, all funded by the Department of Health. We have 86 last year and again 86 this year. And in terms of undergraduate positions, and I believe, let me double check, if these are the positions that have the tuition obligations, yeah, the obligations that people practice. So this is the 86. So there's been no change. It's 80, it was 86 last year and 86 again this year. And undergraduate seats, 75 existing and 75 going forward. So again, it adds up to 161 existing seats, which is this, it's go forward. So no additional seats have been added, but no seats have been taken away.
The Honourable Member for Halifax Clayton Park.
I still would like to explore a little further about the new school in New Brunswick and the fact that there are 20 seats that were freed up at the School of Medicine at Dalhousie, and they have the capacity to fill those seats. And there's been a lot of discussion about a year ago around, or even a little more than that, around Nova Scotia filling the seats with dedicated people that we contracted, you know, that we signed a contract with. You, I think you understand what I'm saying. I haven't heard about the 5 or 10 or up to 20 seats, and I don't think that the School of Medicine wants 20 seats. I think they felt they couldn't expand to fill the full 20. I was in to see Dr. Mary at Dalhousie to try and just, you know, talk to them about their work and this human health equation that we have for health, you know, specialists. We're definitely in a crunch for nurses, doctors, and every other person working in the healthcare field. I wanted to talk to him about what they could do to expand their services. They don't think they can take up the full 20, and their reason given was that they need to provide residency spaces for the students, so they're looking not just at the space in their first-year class, but can they provide residency positions, and especially if they're still supporting the ones that are doing their first 4 years medical training in New Brunswick. But there is capacity there to be filled if they had, you know, again, the support of this government to fill the seats with people who want to stay in Nova Scotia and be doctors, family doctors here, where we need them for at least for a few years. And so 161, you know, I appreciate knowing that number, but that doesn't address the added capacity at Dalhousie. So I wonder if the minister could try and just go to that narrow part of that.
The Honourable Minister of Health.
Thank you very much. Mr. Chair, there is a medical school now in New Brunswick, and a new medical school in New Brunswick. And students who previously, from New Brunswick, who previously were here studying at Dalhousie will be studying in New Brunswick. And those seats those spaces have gone to New Brunswick. We are not financially in a position to expand the medical school, notwithstanding the fact that now they have the capacity to take additional seats. And it is a bit of a misnomer that we have a doctor shortage in Nova Scotia in terms of our overall numbers. Mr. Chair, we actually have one of the highest per capita doctor-patient ratios of any province in the country. But what we don't have is we don't necessarily have doctors in some of the underserviced communities. So it's, you know, it's partially about getting people into those areas and recruiting into those areas. So no, there are no new seats being added to Dalhousie's Medical School in this budget, but there are no seats being taken away from the medical school either. It's a scenario where we're essentially holding the line. And, you know, Mr. Chair, the member started off by acknowledging the situation, the financial situation that this province faces. This province faces a significant decrease in offshore revenue. We're coming out of one of the harshest recessions that we've seen for many, many years, and revenue has declined. And so I think that, and it's very expensive to fund seats at the medical school. It's a long-term commitment, and it's one we have to make, and I have no difficulty with that. We have a fantastic medical school here, excellent dean. He's got a great vision for the school, and it's very important that we support Dalhousie's Medical School, but an expansion of the seats at the medical school at this time is definitely not in the cards. It's certainly not in this budget, and it's all about our ability really to do what needs to be done and what the priorities are, and this would not be top of the list really when you think about the incredible need we have to try to get our emergency departments functioning properly and people who are in acute care beds inappropriately out into community placements, and the services that are required to support that flow to make that system work. It's very, very important. And additionally, Mr. Chair, we have to be able to allocate some resources into health promotion to improve the long-term prospects for our population, to take some pressure off of the healthcare system. So there are many, many areas of need, and you know, I appreciate that Dalhousie has, you know, they have a vision and they have aspirations for their own ability to grow and expand. But I think it's very difficult at this time to be asking for very, very limited public resources to go in that direction. Moreover, I think it's not unreasonable, and it's no secret, that we're asking our stakeholders, we're asking our partners, and the medical school are one of those partners, to help their province deal with a very difficult financial situation, and to look at ways that they might be able to contribute to some of the solutions. The problems we face are not problems that we're going to be able to address on our own. I want the honourable member to know that we do have a program under development for tuition support related to rural retention of physicians in this budget in the amount of $300,000. Mr. Speaker, it's a program where funding will be provided as an incentive to medical school students and/or residents in exchange for a return of service commitment to designated underserviced and rural communities on completion of their studies. And it's for family physicians as well as other designated types of specialists that are under-resourced in rural communities. I'm also cognizant that the people who are studying in these situations will probably have access to the student tax credit that the government announced, which I think amounts to about $15,000 over a number of years if you stay and work in Nova Scotia. So, you know, these measures may not be as large as we would like, but they certainly will have an impact. And I can tell you, because I know a few people who are students at the medical school, and what an amazing group of young people are in those programs over there. There are many, many students who really aspire to stay in Nova Scotia, practice in Nova Scotia, return to their home communities. And, you know, I think that these measures are an indication that we will be supporting them, and certainly we value what they will bring to our province, as past students from Dalhousie Medical School have.
The honourable member for Halifax Clayton Park.
Thank you very much. And we've uncovered a few things, and one would be that there are no students right now with separate contracts to stay in the province and to work in underserviced areas. That was what I thought was in place. I don't know if other members of the House were thinking the same thing, that it had been put in place previously, but apparently it's not there. So I know it's only a few seats, but I think it's important that we be clear that there are none of them now. I appreciate what the minister said about it being expensive to fund the medical medical school, but right now we're funding and subsidizing every single student in that medical school, and many of them will not be in our province after they graduate. They'll go elsewhere to do residencies, and they will not stay here. And we don't have any sort of system in place other than, I guess, the $300,000 program that the minister mentioned to help direct them to some rural and underserviced areas. And, you know, it's not, today I guess is not the time to have a question or a discussion about whether we have a large number of doctors or whether they're properly deployed. But we, you know, even in the city, I can tell you it's difficult in HRM to get a doctor if you want a family doctor. And I recently had looked at all the clinics and all the places in Clayton Park, and there was no doctor taking any new patients. And I'd been checking for over a year, and, you know, I was lucky to have a doctor, but I wanted to change, and there was nowhere to change to. And I had to wait until a new doctor opened a practice, and I don't think that that shows a great surplus of doctors in HRM at the family practice level. We may have a lot of specialists, and I think that is what skews our numbers, is a high number of specialists, because we have regional hospitals and like the IWK that serve the entire Atlantic region, and many people are brought here from around Atlantic Canada to the QE2. So, you know, it's not as simple as saying, and I know that the minister often says that's very complicated, but it is not simple to say that we have a lot of doctors. Mr. Speaker, or Mr. Chair, I am just still wondering about where we might find a few of these other figures. My first question, since I really was trying to drill down on the physician training seats, is that you said this is a funding formula that was repeated in the Department of Education. So just to double check, if the Department of Education had been paying it, and so had the Department of Health, does that mean that now the Dalhousie Medical School is getting less money than it did? Is it getting $2.5 million less?
The Honourable Minister of Health.
Yes, that is correct, Mr. Speaker.
The Honourable Member for Halifax Clayton Park.
Okay, well, thank you very much. And I think that must be a pretty significant part of their budget to be losing $2.5 million. I haven't spoken to them, but I hope they're going to be able to maintain their work and what they're doing, because that is a big change, and I wonder if there wasn't some way to cushion that. But again, you're looking for duplication, and I do understand that. I wonder if I could look again at the other research versus the research grants in the AFP, and where that might be, since this was initially what you thought it might have been, and it's got to be somewhere else in the budget, where we have discovered that because you're paying doctors now an alternate funding arrangement, and that will include, I think, time that they spend at Dalhousie or research that they do at Dalhousie. It appears that you may have cut the grants because many of those doctors are receiving an AFP. So where would we find that, where there's been another savings evident in the budget?
The Honourable the Minister of Health.
Thank you very much. And while we're getting that information, I want to go back on physician recruitment and retention and what have you in the various DHAs, and tell the honourable member that last year we had 18 new family physicians in the Capital District Health Authority recruited into the DHA, this DHA. But when you look at other DHAs, it's pretty dismal. It's, you know, 0, maybe 1 or 2, 5 up in Cape Breton. It's a real challenge. And I appreciate what the honourable member is saying, that, you know, it's maybe no picnic in Halifax finding a family doctor. Especially, I think, in some very fast-growing areas like the honourable members, it can be a challenge for newcomers to be able to find a practice that's close to where they live and that kind of stuff. And probably one of the things that we need to do is we need to have a better system of communication and making information available, so that I know that there are often physicians out there that are in fact accepting new patients, but it's really hard to find out who those people are. We have such a culture in Nova Scotia of word of mouth, you know, and if you come here from another part of the world or another part of Canada even, it can be very difficult trying to negotiate your way to a new family physician. And, but the other thing that we have are the walk-in clinics. Here, we're seeing a real growth in walk-in clinics throughout both Metro, and I'm finding now in some of the other small urban centers around the province. And these clinics are really fabulous in that they certainly have flexible hours. They have an opportunity for people who need to see a physician in the evenings and the weekends, be able to get primary care. I'm told that when a clinic opens in a community where there hadn't been one before, it takes an enormous pressure off the emergency department. The numbers in the emergency rooms just drop like a cement block. And so this, I think, is proof that one of the problems that we have around emergency room use is the lack of access to primary health care. It just reinforces our need to do that. And we really need to incentivize as much as we can primary care, group practice, flexible practice, and certainly practice outside the urban core here in Metro. But, you know, the honourable member knows that I grew up in the Antigonish area. This is an area that has a fabulous history of being able to recruit and retain family doctors. They have actually very good numbers in that particular area. And so we need to, I think we need not to overstate that every place is, you know, kind of in crisis. There's a lot of stability in our healthcare system and access to healthcare providers. And I think as well, we need to learn from those areas and those communities because I think that's very significant. So the honourable member had asked a question as well about where the reduction is around research and the AFPs. And that reduction, I'm told, is in other programs, page 13.8 of the supplement. Yeah. And if I could just elaborate so the member would be aware. So there was a grant to the medical school, which the medical school used to pay research assistants and what have you, which is also part of the payments to physicians through the AFP process, where they get a certain portion. They don't necessarily get a certain portion, but there's an envelope that is paid, and a certain portion of that envelope is for clinical, admin, and research. So again, over the years, as the funding arrangements changed, there was some duplication, but there was never any adjustment for the fact that there was a duplication. In terms of the amount, in 08-09, it was $3 million. In 09-10, the year we've just completed, it was 1.5 million. We reduced that in the budget back in the fall, and it's now zero in this budget.
The Honourable, the member for Halifax-Clayton Park.
Thank you very much. It's interesting that it is in other programs, because that's where I wanted to go to next was, again, page 13.8, which has a line item for other programs. And it does say in the note to it that it provides funding for other programs such as autism, the methadone direction 180, which I think is in the minister's writing, and oncology. So I wondered if we could get a breakdown of that. I'd like to know really, you know, what it is. And also it has gone down. I think, yes, it is down about How much is it? 1.6 million, I think, from last year. So I wanted to know really where that was. I guess we've now identified 1.5 million, the majority of it, right? I did want to explore and see what had changed in that. And since, again, it's a bundle of things, there could be a few others that have gone up or down. That 1.5 might have been seen another program go up a little bit. So if there's any that have moved within that, of the significant items, you may have a huge list of them, I don't know. But, or perhaps the minister could make available the list of those programs for us. I'd welcome that as well if we could have a breakdown of that. But for today, if you could answer. Thank you.
The Honourable, the Minister of Health.
Thank you very much. I believe that there is not going to be a cut to the methadone programs, for example, but there was a transfer, a transfer to the DHAs, and yes, I do have additional information here that I can table, which outlines all of the things that are in this particular area. Yes. So perhaps I'll get a copy made and we'll table the copy for the member. Thanks.
The Honourable, the Member for Halifax Clayton Park.
Yes, I would appreciate that from the minister, because then I can look myself and see if there's any other items that jump out at me as having been altered, or even to explore what they're for exactly. I mean, those programs for autism we think are tremendously important, and I will at another time come back to that as a subject for discussion. As I indicated at the outset, we have a number of hours that we will spend exploring different programs, but if I had the line item on autism, that would help as well. And I mean, oncology is another one where, clearly a very important item for us to look at. Now, again, I don't know what's in that, because a lot of the direct service to cancer patients happens at the DHAs, so I'm not sure what exactly is in the oncology. But if you table that, and I could perhaps ask the page to get a copy of it for me, that would be very helpful, and we'll go back to that item either today or tomorrow when we're coming back again to look at this. So I will leave that just for the moment and go to, I wanted to go to the caregiver allowance, which the minister remembers we had a lot of discussion about, because I think there was a lot of confusion last year about what exactly the caregiver allowance was, who was going to be eligible, building up a lot of expectation and hope for some families who applied for the caregiver allowance and didn't receive it. I think it's on page 1315, so page 15 of the health estimates. And where would I have seen that? It's a line item there at the bottom after all the DHAs are listed under this home care services. There was a line item that says caregiver allowance program. And it's actually a real, I'm perplexed by it, and I guess things have changed. Something else has been rolled into it, because it was first last year estimated for the 09-10 year at $2,700,000. We actually spent only $1,200,000. So it was underspent by $1.5 million. And then this year we've bumped it up to 4.6. So we bumped it up another 3.4 million. So I'm not sure. We had a lot of discussion here in the House, because we had constituents who were calling us, and the minister knows she probably had her own constituents calling, having applied for that program and not getting it. We had a lot of discussion about who it was really intended for and whether it was the right program, and a lot of people were disappointed. But, I'm sure the minister could talk, at least initially in broad terms, about why did it not get spent when there was such a demand for the program, and then being underspent, why has it jumped up? What else have we added to it? Some other program must be in that caregiver allowance program line. So could I ask the minister to please give me that?
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. Mr. Chair, I'm very happy to talk about the caregiver allowance program and the numbers that the minister has, or the member has identified here. when we launched the Caregivers Program, Mr. Chair, you may remember that back in the fall session, I said many times in this House that we had made a commitment in the '09 election to have our own program to assist people, a self-managed care and a personal alert assistance program, as well as a, the self-managed care program was our version of a caregivers program. And so we had, in the campaign, said that this was a commitment that we would keep in the first year of our mandate, and we had allocated a certain amount of money to cover that commitment. So that's reflected here in the increase that you see from 2.7 to 4.6 million dollars, almost a doubling, or not quite a doubling. And we are in the process of reviewing the caregivers allowance. And of developing these other programs, and those will be decisions that will be made in the future during the year, and there will be a rollout around once decisions are made. With respect to the caregiver allowance that was introduced in August, and the member indicating that it was significantly underspent, the money that was allotted, I can't remember for sure, but I believe that we allotted funds for a full year, but the program was only introduced in August. And so it was late being introduced, and then there was a period of lag before the first people came into pay in the program. We are not that far off the target in terms of the numbers of people who are intended to be assisted by that program. The department staff who designed the program and projected that about just slightly under 750 people would be eligible for that program in the first year. And the last briefing I've had with respect to the caregiver program, we were at about 640 people. So we were off maybe 100, 110 people. And we still had, the last briefing I had, we still had at least a month or two to go in the fiscal year that we were in. So we haven't been withholding funds. We've tried very, very much to be fair. And what I mean to be fair is that the program was designed, it had a set of criteria, and in spite of the very compelling cases that exist for people who missed the criteria, who didn't meet those criteria, we did not open the program up because we didn't have the capacity to open it up to everybody who missed the criteria. And in all fairness, we would have been picking winners and losers in that process. And we decided the best thing to do would be to keep the criteria where it was as it was introduced, let the first year of the program run its course, evaluate how that program worked and where people were, where they missed out on qualifying for the program, do some consultations with stakeholders who had been involved in the initial development for the program, and look at moving forward with the program. So the Caregivers Program is a very valuable program to many, many people in the province. We know there is a great need and a great appetite for an expanded Caregivers Program, and we are working toward addressing some of the concerns and looking at where we might go from where we are today.
The Honourable, the member for Halifax Clayton Park.
Thank you, Mr. Chair. And I do want to explore a little bit about the 640 people that have now been accepted into the program and just get some other numbers on the old caregiver allowance program. I understand that the minister says there's been consultations and a new program is going to come in, so I'd like to explore that part a little later. But if we could get a little bit more background, I accept why you said you're underspent. We started late in the year, so the budgeted amount for a full year didn't materialize, because it just looked, you know, given that we knew how many people were applying and the number of people who were being rejected, it seemed kind of, you know, out of whack that we'd have half the money not spent and the government not accepting people into the program. But at the end of the day, I guess I'd like to know if we could, and I'm not sure if the minister has this, although I imagine she would have anticipated this question, but to find out how many applied by DHA and how many qualified. And I think that's something that we have been asking about, and we got some preliminary figures during the House in the fall when the legislature was sitting. I think it would be useful to know where we are at in terms of the number who applied, the number who were qualified, and it might even shed light on where the demand is for the new self-managed care program, because a lot of those people may be candidates for that as well. So could I ask first the very pointed question about whether you have the figures on the number who applied and the number who were accepted into the caregiver allowance program?
The Honourable, the Minister of Health.
Thank you very much. I'm just going to ask the deputy for his book for one moment. As of the middle of March, there were 661 recipients of the caregiver's allowance. And we had 933. This is from, I'm presuming, from the inception of the program, from implementation until the date mid-March. We had 933 persons referred for assessment, whether or not they would qualify. So, and it's very difficult, you know, it's very difficult to have an accurate picture just through those numbers. There may be people who were never referred for an assessment who applied, you know, who in no way, shape, or form would come within a country mile of being eligible. You know, there may be people out there who heard there's a caregiver's program, and I'm a caregiver, and they would call up and go through kind of an initial assessment. Perhaps they have an income that's far beyond the income cutoff, so they wouldn't be referred. So these are the numbers that tell us that 933 people were sort of taken a look at by the single entry point, because that's where they call, and referred on for an assessment with the thinking that they may qualify for a caregiver's allowance, that they, you know, they would fall within this. And we have, you know, as I said, the 661 people receiving the caregiver's allowance. And did the member ask for by DHA? We can provide that. I don't have that information here with me, but I certainly can provide by DHA to the member.
The Honourable, the member for Halifax Clayton Park.
Thank you very much, and I would like to have that by DHA. If you don't have it, we can receive it in the next little while. I'd like to ask you now about, you know, obviously the item remains here on our line item. We know that there are 600 and what do we say, 661 now in the program receiving benefits, and that I'm sure, you know, is a great godsend to those families that are receiving it. Even though it's not a lot of money, it certainly will help each family. I'd like to know what's going to happen to them. Will they remain in this caregiver caregiver allowance program, or do you see them becoming part of a new program that you're bringing in? Will they be grandfathered? Are they guaranteed? I mean, they've already been assessed and gone through probably a pretty rigorous program. So, you know, I just want to look for some assurance that they will remain in one or the other, and perhaps get the minister's view on whether you want them all in one program that you feel that is more an NDP design program, one that you take more ownership of.
The Honourable the Minister of Health.
Thank you very much, Mr. Speaker. And I want to assure the honourable member, Mr. Chair, and assure people who are receiving the caregiver's allowance that no decisions would be taken to disadvantage people in terms of the services and the programs that they have right now. Mr. Chair, I don't know precisely the details of where caregivers will go, caregivers to, if you will, at this stage, because we are still, you know, doing the assessment of what all of the possibilities are, and these are decisions that are yet to be taken as we refine the information that we have in terms of what would, you know, what is possible and what would make a difference and what's advisable. But it is the case that certainly many groups that we have had contact with in the department are very appreciative of the program. And for the people who are receiving the program, who have been able to qualify, it has served a very important function for many of those people. And so we recognize that in the department, and we would always take that into consideration as we develop, you know, new programs and move forward with any new services.
The Honourable the Member for Halifax Clayton Park, and I would remind her there's about 5 minutes left in this round.
Thank you. I was going to mention that to the minister, that my time is growing short. I wanted to, and I know we have more than enough questions to finish up with this caregiver allowance, but there's so many other areas to come back to. I wanted to ask right off the bat if you have any idea when the new and better program will be launched. Quick question.
The Honourable the Minister of Health.
I have, Mr. Chair, I have no light. Mr. Chair, I have no idea when the new program will be launched. I wouldn't want to give a hazard a guess.
The Honourable the Member for Halifax Clayton Park.
Thank you very much. Well, Mr. Chair, again, the amount in the budget's gone up significantly, so you're intending to increase the program, and that has to reflect an idea that a new one's going to be in place for the year. You know, again, are you expecting that to be half a year that you're budgeting for again? Maybe just carrying on with the 661 that you currently have and not adding more? I don't really understand, if you're that close to budgeting a dollar figure, why we don't have an idea when it's going to be introduced.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. I think we would all agree that last year was kind of a unique year in many regards. It certainly was for me, Mr. Chair. I don't know about anybody else. In terms of the introduction of a new program, we will follow the usual pattern. We want to make sure that we have done the work, the development work that goes into a new program, and there's considerable work. And you know, the staff in the department are to be, particularly in continuing care, are to be commended for the work that the tremendous amount of work that they have done over the past 10 months. It is really, it's really pretty significant. So we will have a new program, and we will unfold this program, you know, when it's ready, when we know what it will involve.
The Honourable the Member for Halifax Clayton Park.
Well, I appreciate that, and I guess this is one we're just going to have to watch and stay tuned as you announce a new program. But I would like to know if right now you're considering family members as being eligible for the support that will come through your new and better self-managed care program. I'm using your words because new and better is how it's been defined. You know, we're hoping it will be. But I'm just asking, will family members be among those who will qualify? Because that's, as you know, been a big stumbling block for many people, and I don't need to remind the minister about the people who give up their own work, about, you know, family members who won't leave their loved ones without an attendant and will actually give up their own ability to earn money in order to stay home. And it's a big sacrifice for them in the long run. For a lot of women who end up with no pensions and no way to retire, you know, they sacrifice a great deal. So I want to make sure family members are being considered.
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And I'd say to the honourable member, when we design and develop a new program, we look at all of the possibilities. We look at a whole range of options, and we weigh those options very, very carefully. We do as much research and analysis, gather as much data as we can, try to make as accurate a projection as we can based on the information we have in terms of what we're looking at. So we throw the, we cast the mold very broadly, I would say, and then we, start as it becomes clear what it is that we're dealing with. We start to hone in then on what exactly will be provided at the end of the day. But we don't rule anything out initially when we look at designing a program. We have objectives, and we have a range of possibilities of how to meet those objectives. And but it's still too early to say what at the end of the day the program will look like.
Honourable the member for Halifax Clayton Park.
Thank you, and I know this is my last chance on this this hour, but I'd like to ask, in your platform, there was a $1.8 million commitment, and it was for seniors with self-managed care, specifically seniors, and the personal alert systems. Can you give me an idea how that broke down in terms of the $1.8 million? I realize I'm going back to an estimate that was in a platform rather than what you may have, but I'm wondering if you can answer me today the relative breakdown of those two, and whether the personal alert systems is also going to be in that caregiver allowance line item.
Order, please. The time allotted has expired. I'll now go to the Honourable member from Argyll.
Thank you very much, Mr. Speaker, and just wish the conventions of this House would allow me to give her my next hour and she could just keep going, because ultimately I think she had a number of great questions, and I do want to thank the member for Halifax Clayton Park for her questioning. But I will probably move around to some different things. I'm sure she'll pick it up as the next hour rolls around. First of all, I want to welcome the minister for her second round of estimates as Minister of the Department of Health. I do want to welcome, of course, her deputy minister for his second round, but congratulate him this time, because when he was here last time, he was acting deputy minister, and this time he's the full-fledged. Now, I don't know if you got any more money for that, but I'm glad to see you here. Linda Penny. Always good to see you again here. She is second to none, and the dollars that are in her head, I tell you, the numbers would scare anyone to know the dollars that she keeps track of within the Department of Health. Mr. Speaker, Mr. Chair, I do want to maybe hit on a few of the interesting parts within the department, things that may be left over from my time as minister, things that were started by our government, and things that I think have made life better for Nova Scotians in the long term. Of course, I'll probably be talking a little bit about the continuing care strategy, maybe get an idea of where that strategy is today when it comes to bed placements, and of course the other programs that are within it. I'll probably be talking a little bit about the pharmacare programs, more specifically to the family pharmacare program, one that I was very proud to stand with Premier Rodney MacDonald at the time, and bring that first iteration to Nova Scotians, as well as talking about HealthLink 811, and how proud I was to see the phone lines turn on when the minister announced that over in Burnside. doesn't seem so long ago, but you know, we're getting close to the year really when you really get down and think about it. Maybe have some idea of the benefits that Nova Scotians are reaping from this so important service. Mr. Chair, as you know, for many years now, I've been advocating for the continuing care strategy in the province, and I was very happy to start a process in what we felt was the largest construction of health facilities in the province for many years, with the addition of about 800 beds in the province. Mr. Speaker.
Order, please. The chatter in the chamber seems to be rising a little bit, and it's getting hard for the member to pose his questions. The Honourable, the member from Argyll.
Thank you very much, Mr. Speaker, and I've sitting here for many hours. I didn't even notice that, so thank you for that. Normally I'm delivering the noise. Yeah, this is. I know this is probably the most civil you guys have seen me in probably the last number of months, and actually some of my first health questions really in this sitting, and tell you the honest truth, Mr. Chair, I haven't had many issues with the Department of Health over the last bit, and I do want to talk about specifically again when it comes to the long-term care facilities and the process that is forward. So I was wondering maybe I'd give the opportunity to the minister to maybe give us a little update on long-term care construction, and then she knows I'll probably go towards maybe a couple of the facilities that are in my region. So maybe an update on long-term care.
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. Well, first of all, I welcome the honourable member to the discussion about our budget, and I know you know a lot about the department, having been a former minister, and I know that continuing care is an interest of yours, and I suppose a legacy as well in many respects, the continuing care strategy, as well as the 811 line, a very good move indeed. Long-term care, it represents 13% of the healthcare budget. I don't think that really has changed proportionately from probably when you were a minister. And it constitutes $472 million. A fair chunk of change. The continuing care strategy will have committed over $260 million by 2016 to enhance home and long-term care. In total, 1,320 new long-term care beds will be added by 2015. And this will be in addition to previous commitments, 125 new beds in Cape Breton and 150 new beds in the new Northwood Bedford facility. And I would say to you and all members, I toured the Northwood facility a few weeks ago, and it is phenomenal. I said I have my room picked out. It's just unbelievable, unbelievably beautiful. I was there with the with the member from Hammonds Plains, and he has his room picked out as well, but he's going to have a long wait. I'll put him on the wait list for a long time. So now the member is interested, I know, in knowing where we are in terms of getting to completion in terms of getting beds up and opened. 840 new beds were committed to be opened by March 31st, 2010. And the remaining 480 beds were committed to be opened by March 2015. We are not going to have the 840 new beds open by March 31st, 2010. But we're going to have quite a few new beds open by March 31st. We're going to have 362 new beds opened then, and 360 more will open by the end of this fiscal year. Now, there have been some delays, as there often are in, when you're undertaking so many construction projects around the province. And they've been, they've all been, I shouldn't say they've all been different, but, in some communities, there have been issues that have come up in terms of trying to get the right design and to bring a project in for the amount that has been budgeted for. It's been a challenge, but I have to say that as tough as, it's been from time to time on some of the projects, the staff in the department and the people in the community who are very dedicated and are very purposeful in ensuring that they complete a project and they do the right thing for their community, that there's a meeting of the minds that happens there, even though there may be some bruised feelings once in a while in the give and take in the planning of this. We have staff in the department who aren't spending their money, they're spending the public's money, and they need to ensure that we're getting as much value for dollar as we possibly can. You have the folks in the community, and they are not, it's not that they're irresponsible around money, but money isn't their primary consideration. Having a good healthcare facility for their loved ones, their seniors in their communities is their motivation. And so it's quite a dynamic process, I find, and it's going quite well. There have been delays along the way, even the Northwood project. I don't know how many dates I've seen scheduled for the opening of the Northwood project, and I was kind of rushed out there to get a tour before it opened to see the facility. And while I was there, I think I was given perhaps today's date as the date for the opening. So it's been a an interesting process. So for this year, new and replacement beds, 797, I'm told. There'll be 797 at an operational cost of 39.3 million, an increase in 39.3 million. So it's one of the things that people want to know is, okay, so we have a financial problem and challenges in Nova Scotia, yet the health budget grew by 212 million. Why is that? Well, partly why that is we still have to provide health care services. We know that long-term care facilities, many of them were old and didn't come close to meeting good quality standards for care. Without those standards, workers get injured, our workers' compensation costs go through the roof, the quality of care for seniors can be jeopardized. So we need new facilities, but when you bring on stream new beds and replacement beds, quite often your operating costs will go up. And but I have to say, these facilities, the ones that I've had the opportunity to tour, are they're phenomenal, and they are the kinds of places that our seniors deserve and our healthcare workers deserve. And I think people will be very happy in terms of the quality of healthcare that they will receive in these facilities.
The Honourable, the member for Argyll.
Thank you very much, and I appreciate the answer on that one, and I also can see that this is a major concern for the minister, and one that I know she will work her best to make sure that seniors in this province are treated with respect and in the facilities that they deserve. I too had the opportunity to visit many of the homes. There was a a list of people that wanted the minister to visit their facility and list off the deficiencies within those facilities. And I can tell you, there was a lot of places that you went to, you sort of shook your head, and which you know, ingrains you even more to make sure that you'd make those changes in those areas. I don't have to go very far from my community to visit Saint-Joseph-du-Lac, to visit Tileview, two of the replacements that we do have going today. Villa, with, you know, great history for those of you who have visited Yarmouth on many occasions. As you go up Lake Milo, you see this beautiful facility at the end of the lake. This was an old CP hotel. I mean, it was converted into a long-term care facility. Now, 30 years ago, when the sisters first, 30 years ago, 40 years ago, 40, it was 1964, so 46 years ago, when they did start the facility, the care needs were far different than what today we ask for a level 2 facility, and I know the Minister of Fisheries has been to the Villa on a number of occasions as well, and not just a bad situation for the residents who have to climb downstairs, because there's, I don't know if you remember some of these hotels, there's half floors and all kinds of stairs, and you know, and today when you're in a wheelchair or your mobility is challenged, the opportunity to get down or visit in the common room is very infrequent today, and like the minister was saying, the workers. You know, their incident rate goes up because they're trying to lift and move and do all the things that they shouldn't be doing because the facility is not adequate. Mr. Chair, the numbers are looking good. I can't say they're perfect, but they're looking good. And if I was ever to have a do-over on processes, because I can tell you, as processes were presented to us when we were looking at the construction of homes in the province, there were many aspects that were brought to us, and not being an engineer and not being an architect, it always felt it was good to have some of these people in it. Today, I would be less than happy with some of the processes that they've been in place, because I've seen the impact of a lot of discussions and maybe lack of oversight. And I don't mean that in a mean way. It's just there was so much to do with the staffing that we've had that we did have to farm it out to other organizations to try to take care of. And through the process, and I'll get to the example, is it was really difficult for those community groups to know who was working for who. And I think in some cases, not being those professionals, that you know, people have fallen into some traps. And you know, the elms, and I know the member for Hants, Wes, will be talking about the elms when he has the opportunity. I'll be talking about Nikhil later on. You know, and I think we've fallen into some traps in some of those places. And you really can't blame anybody for it, but I think the process, if I had the do-over, I would have changed some of the processes that were in there. And the Minister of Fisheries would know also, even in the construction of his facility, you know, the biggest log jam was really the engineering and the architecture, to make sure that we had the information meet the specifications that were set forward. So, you know, there was a lot of things there. So I will go a little bit to home right now and talk about Nikhil Home for Special Care and the ongoing saga of the 22 beds, the 12 beds, and now who knows what beds. So I'm just wondering, you know, maybe you can provide an update on my specific facility, Nikhil Homes for Special Care.
Honourable the Minister of Health.
Thank you very much, Mr. Speaker. Well, right off the top, I would say we are committed to working with Nikhil. There's no question that there's a need in that area, and there's, you know, it's not just about a need. There's a need, but there's also an existing operator who's very competent and appropriate to be providing services. So, and as I understand, this home for special care had 12-bed allotment, was increased to 10, so a 22-bed expansion. And then because of budget, the difficulties of bringing the project in at 22 beds at the budget that we have available, then a decision was taken, difficult decision for that board, I recognize that, to scale it back to the initial 12-bed expansion. And I believe that tenders have gone out, have they not? No, tenders still have not gone out. So we're working, I think, toward that process to be able to get tenders out for that expansion. But let me say this, that, you know, the money isn't going away. The money is in the budget. The money is there. The commitment is made with the operator. And it's back to what I was saying earlier. You know, the staff in the department are totally dedicated to getting these projects done. And I think there'll be a big party in the department when some of these places have been able to complete their projects, because then, frankly, we'll be able to go on and focus on other areas of need and other things that need to be done. So people are working really hard, and I want to assure the member, if there's anything I can do to facilitate that process, I certainly will. But it is also the case that I don't have, you know, money under the cushions that to make this, to grease the wheels and make it happen quickly. We do have a budget. We do have to bring the projects, you know, in on budget. It's a very expensive undertaking, the whole continuing care strategy, and we have a long way to go yet. So we'll continue to work with Nikhil, and I think at the end of the day, I think everybody will be happy, because, as I said, these new expansions are phenomenal, and people are genuinely so happy to see that they can provide a better quality living arrangement and working arrangement for people in our communities. And, you know, these projects will hold us in good stead then for a number of years forward. So I don't know if that provides the level of detail that the member is interested in, but we'll start there and then we'll see what else is required.
The Honourable, the member for Argyll.
Thank you, and I do appreciate that update. The added piece that maybe I would ask too is that I know that the administrator and the board chair were in to see the deputy. I don't know, probably a month ago now, and I figure a month ago. I'm looking at the deputy here, and I'm thinking it's a month. Anyway, and the concern that they brought forward really wasn't the. I mean, I think they have faith that things will get worked out and we will have the 12-bed expansion move forward. The concern that they have today is that through this process, they've accumulated somewhere close to about $600,000 worth of debt. And that was attributed to the project manager. It was attributed to some of the architecture. It was attributed to a water problem I think we've had at Nikhil. It was always there at Nikhil, and as a matter of fact, probably, you know, if we would go back 30 years or 20 years when Nikhil was first put in, I think they probably would have picked a different site because of the water issue that's there. So the concern they have today is that they have this debt. They're sort of stalled in trying to figure out the cost containment and try to figure out how to get the tenders out. That they took out this mortgage, I believe it was at Royal Bank, for somewhere close to $1 million, where they've spent approximately $600,000 of it. And it was basically a term loan, and that term loan is due at some point this summer. So as time goes on, I think they're taking dollars out of their operating budget to pay the interest on that loan. Normally what would have happened is, because the construction would have moved forward in a timely fashion, that once the service agreements were done, construction began, and all that dollars could have been rolled over in the new mortgage for the whole facility. But since that hasn't happened, they're now holding the $600,000. So I was wondering if you're aware of that dollars, and I'll keep talking until you have the full information in front of you. And I'm just wondering if there's a way to help Nikhil so that they're not taking out of their operating budget to pay for this leftover loan that they can't roll over into the new mortgage until such time that they can begin that construction.
The Honourable, the Minister of Health.
Thank you, Mr. Chair. And I am advised that we don't have the ability to advance loans to private operators, any operators, that don't have a mortgage, because I guess the mortgage is used as a way to secure in some way, you know, to secure your interest in a venture. But I do know that this was an ongoing concern, even back when we were having the discussion about 22 beds or 12 beds or what was going to happen. And as I said earlier, you know, I see the staff, the deputy, and the staff that he directs as problem solvers. They really have proven themselves over and over again in terms of problem solving. And they're there to look at the problem as it exists and to look at what our ability is to address those problems. And, you know, there's a lot of give and take in these processes, but at the end of the day, I have not seen too many problems that haven't been sorted out through that kind of process. So I thank the member for bringing this to our attention, and I'm sure it's something that we will, you know, embark on some process to see what, if anything, can be done.
The Honourable, the member for Argyll.
Thank you very much. And you know, just a little history on that is originally what would happen is that, you know, for 30 years the department advanced money for construction, and we were informed when we were government by Treasury Board all of a sudden saying, you can't do that. And it's like, I can't swear, but I said something else other than what I should say in this house. So it ended up that all these independent organizations had to take out loans in order to get some of the work done, the preliminary stuff, in order to move into the mortgage, and when such time came. So anyway, just to say that Nikhil's caught in a little bit of a conundrum here, and need a little bit of help to get through it. So I know the deputy's aware, I know you're aware, and I'm sure the staff will find a solution to it. I also want to thank you for your comments around the new Northwood, or what we call it now, Northwood, Hammonds Plains, or I don't know what the new name for it is, Bedford. The last time I was there, and actually, Mr. Chair, it's actually kind of funny. Last time I was there was when the construction was just getting going, and the foundations were just getting going. And that time, there had just been a press release by the official opposition of the time. There was a really nice official opposition. The official opposition put the press release wondering, where's the new Northwood? There has been nothing going on. And I was really happy to bring to the House pictures of the foundations that were put in. So I always got a kick out of that, because that was really you know, a lot of times we get to have fun here, and that one was actually kind of fun. But I do drive by the Hammonds Plains Road quite often as I head home. You know, if I do run down to Bedford to visit my family, or I drop into Bicycles Plus, I do head up the Hammonds Plains Road, and what a facility. I think Nickham and Associates, who are the architects on this job, have outdone themselves. And when you drive by, for those people who really don't know what that orangey, yellow, and a whole bunch of colors building is as you walk on, drive by it. And it's made in such a way that a senior that is in the facility can say to their grandchildren or relatives that are coming to visit them, I live in the second floor in the brown one with the hatched roof. And honest to God, you go there and it's that one with the round window, because that's how they designed it on the outside. The inside, And I've only ever seen the foundations, so I can only imagine from the visualization that Benji Nickham was able to give us that day of, okay, this is where the great room's going to be, this is where the courtyard is, and this is how things are going to, wow. It's a design that I think will last forever. And knowing how it was built, it probably will. It's probably better than any bomb shelter, I think, than we've ever had in the province, because it's a lot of cement. But it's going to be a home for I forget how many residents, but it's quite a large facility. But if it does open, I'd love to get to see it sometime. So I really would like to see that. I'm going to change a little bit to French language policy for a second, because also as being the critic for Canadian affairs and of course have been brought in the French language policy. I want to specifically, and I'm not going to use names in the House either, but I was brought this file just the other day, an individual who was brought to Nikhil, and Nikhil used the vacation bed. And we know the problems with using vacation beds sometimes. People get comfortable in those vacation beds because they've been there for a month, and of course expect to stay and stay longer. But the problem that I think I've seen here is that person, even though they were in the vacation bed, could have turned down the first placement and waited till another appropriate placement, whether it would be at the villa, whether it be at the Villa Acadien in Métégan. This individual is 92 years old, speaks French, and would like to stay in the area. Unfortunately, this individual, and I don't know whether the assessment staff provided them with the right information or not. I don't know, but ended up in Mahone Bay. And I know the member for Lunenburg would love to have more population in her area as well. But if I remember correctly, he does vote Liberal, so I don't think it would help anyway. There you go. But ultimately, now an individual who's from West Pubnico, who finally had made his decision to go to a long-term care facility, who wanted Nikhil or Villa or Tidal View if he could, has ended up in Mahone Bay. So I'm just wondering how the French language policy didn't work in this case. So I'm just wondering if you have maybe an update on some of those placements.
The Honourable Minister of Health.
Thank you very much. And as the honourable member knows, I can't discuss any individual cases, but certainly this is something that we will I'm prepared to investigate and talk with the honourable member after this, the session this evening or later on in the week. We are very mindful in the department and in the district health authorities of the diversity of our province and of the absolute importance of treating all of our seniors very respectfully, particularly when it comes to their first language, and being able to provide services to Francophone members of the province is very, very important. And I have to say, I perhaps erroneously make the assumption that things are going well because I hear so few criticisms, or not criticisms, but I'm not called on frequently to intervene in any way in these situations. I know that my colleague, the honourable member from Halifax Fairview, who is also Minister for Acadian Affairs, has been briefed several times in the department on various specific issues, because sometimes things come to him in his capacity as minister. He feels as well very strongly that we have culturally appropriate healthcare services in particular. I mean, if there's ever a time that people are vulnerable, it's when they, when they aren't at their best. when they have health care needs. And so I think this is very important. I can't imagine how disorienting it would be to find yourself, you know, far removed from your community, and then not to have your culture represented in either the language or customs, understandings, that kind of stuff. So if the member would like to provide us with additional information, we'll certainly look into it. And then the larger question of respite care and opportunities to place people is something that I think we can certainly talk about more broadly as well, because we have so many Acadian communities around the province, and with some very great distance, you know, between Cheticamp and your end of the province. That's a long way, and it's important that we have, you know, that we have probably some fallback positions if we find ourselves in a situation where facilities, and I mean this is the world we live in now, where it's not unusual for a facility to be full to capacity, but what ability do we have? What are the wishes of the family? What are the wishes of the individual? One of the things that I think I'm hoping will be a really useful feature of providing health care is now the personal directives, where people can, and I'm hoping that all of us take responsibility to learn a little bit about how these personal directives work, and getting the word out to encourage people to make their wishes known and to get those forms filled in before you get into a situation where you have lost the capacity to be able to act on your own and make your views known. And I think particularly for members of populations that exist in our province in a minority status, it's really important to have those personal directives, and it gives a very concrete representation of the will, what the person wants, and I think it will influence caregivers. You know, caregivers in this province will bend over backwards to meet the requirements of the person who needs care, if that can be articulated in some way, you know. By the person themselves, it makes a big difference if they think that comes from the person themselves rather than the bossy daughter who's here from Toronto for the weekend or whatever, you know what I mean? So I think let's use those personal directives as well.
The honourable member for Argyll.
Thank you very much. And that was always a concern too, that when the French policy was really designed, the challenge we always had, there had to be a fallback to it. Because if you're saying, well, you know, you have Nikhil home, you have Villa, and then the next Francophone one is actually, I think, Pumket. I think there's some stuff going on there, I'm not sure. And then Cheticamp or Arishat. So it's, you know, somebody in Argyll, being Acadian, even ending up in Arishat, even though the language is pretty close, culturally it's still different because of the way the Acadians were expulsed and brought back, and being in such large distances in this province. So I will bring the name forward to you and see if there's anything that we can do, or just get an update of, you know, I understand first placement, second placement, and, you know, eventually trying to move the person back to the facility of choice. And heck, I also know the issue is sometimes people get comfortable in places too. I know a number of individuals who geez, actually I think they were from Bridgewater and they ended up in Meteghan and actually didn't want to move out of Meteghan. They thought that was pretty good. They liked the people there, or they liked the care they were receiving, and didn't see a reason to have to go back home. So it's always a funny little world to be in. The final point on long-term care for today is I requested through your senior policy advisor a meeting for next Wednesday for some individuals who are looking at another long-term care facility in the Yarmouth area. There's an existing facility that might be apt for renovation or change of usage. And that's about as much as I'm going to say today on that one, but I'll talk to you a little more after it as well to see if we can make that happen for these folks next Wednesday. I'm going to change to orthopedics for a minute. I know we can talk to wait times, and I can talk to the 2004 Accord of First Ministers and talk about the 5 priority groups, blah, 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 blah. And I know that we've done really good in a number of those fields, and we've really fallen back in a few of them. And just as much to blame for some of the things that we're seeing today. I did, though, think that we had done a good job when it came to the assessment clinic for orthopedics through Capital Health. Yet, when I do hear from constituents sometimes, they say, well, I'm waiting to see the specialist for the first time, or I'm waiting for shoulder or elbow or whatever surgery that they're waiting for. I'm still hearing, you know, it's been 18 months. It's been a really long time. And the idea of the assessment clinic was that at least they could be seen in a quicker manner, be triaged out to where the most appropriate service that they needed, whether, you know, we all know that half the people that ended up in the orthopedics line didn't actually need a full replacement. They needed some kind of physiotherapy. They needed some kind of scope. They needed, you know, they didn't need the full meal deal. To put it that way. So I'm just wondering where that process is, if it's up and running, what kind of patients they're seeing today, and you know, if we're seeing a reduction there or not. At this point, I'm not seeing the benefits that we thought would accrue from that process.
The Honourable Minister for Health.
Thank you very much, and thank the member for the question. This is quite timely. I met not so long ago with the CEO from the Capital District Health Authority and other members of her staff. They have a new person there responsible for patient-centered care, a real crackerjack in terms of you know, just again a problem solver, somebody who sees the problem and says, you know, I don't need to know why we can't do it. What I need to know is what can we do. And so I think this is looking, I'm very optimistic that we're going to see some really good things occur with respect to reduction in orthopedic waits. Now, I think there are a number of things in terms of, like everything in healthcare, nothing is simple. It's always complicated. There's always more to the story than, you know, the 30-second soundbite. So there are different kinds of wait times. You can wait, you can go to your family doctor, you're in pain, it's been going on and on and on and on and on, and your family physician refers you to a specialist. That can be just a horrendous wait. However, as I understand it, that wait, in fact, has been reduced now because of the assessment clinic, so that you get referred to an assessment clinic which has a group of multi-skilled providers. It can be a nurse, physiotherapist. There are different healthcare professions in the clinic, and they do an assessment and they triage. And actually, this can result in people with the most serious pains and difficulties getting to see a specialist much more quickly. People who have So these waits actually have been reduced. Getting to see the specialists have actually been reduced, certainly for some people, people with the most, you know, highest range of needs. We're still not doing very well in terms of people who have low. It's not that they don't have any. It's not that they have no need, Mr. Chair. It's that they aren't on the high end. They're not people who are in constant pain, perhaps, unable to get around their kitchen, stand up long enough to make a meal. So it's, you know, this is one of the things I think that it's been a very successful program in getting people to see the specialists, especially at the high end. The next thing that, I shouldn't say the next thing that we're working on, but then the next problem is getting people into surgery, getting the list of people who have high need, getting them into surgery, and doing something about the cancellation of surgeries. Because I may be on a list, I may have waited for 6 months, I may have my surgery schedule, I show up, there's been an automobile accident, there's been an ATV accident, you have somebody who has, you know, trauma, and these folks have to be taken in to the OR, and I've prepared myself for months, you know, for surgery, and then I've, you know, just in the last day or two, I've gotten myself everything organized, I've taken time off work, I've rearranged my life, and my surgery is canceled. So there are different problems, and so one of the things that's going to happen as a result of this this budget and the discussions with the Capital District Health Authority, in fact, is we're opening up an additional operating room over at the Capital District Health Authority for trauma surgeries, and also, so this won't displace, you know, it won't displace. And I suppose if there is no trauma, it means you can book. They're also doing some other little initiatives that could make a huge difference, which is, for example, trying to remember the technique, but it's about rather than bringing somebody into the hospital and canceling their surgery on the doorstep, you know, it's having the information in advance, the evening before at least, and not putting people through the trip of coming to the hospital and sitting there and finding out that their surgery's been canceled, but getting the information a bit in advance. So, one of the commitments our government made in the election campaign was to set up prehab teams to reduce waits for surgery. We have put in this budget $700,000 toward that, and these teams will be in the other 3 DHAs that do orthopedic surgery, so Valley, Pictou, and Cape Breton. So Capital, as I said, they already have one. It's working well. They need to, they have a plan to do some additional things to reduce their orthopedic waits. And then these are the things, this is what will go forward in the other DHAs. Now, if I'm not mistaken, we added a 3rd orthopedic surgeon in Pictou. Yes. You know, and they are actually looking for a 4th, and it's something that we certainly will look at, you know, because we do have these wait times, and we have this initiative to set up a kind of a better management of a centralized understanding of our surgical wait lists all over the province. We have the surgical network. You know, we're really moving forward, I think, in lots of ways with different small initiatives that will make the use of operating facilities more efficient, and everybody in the system understands that this needs to happen. That, you know, the time that, let's say, a surgeon thinks belongs to him or her is not his or her time, it's the patient's time. And if for some reason they aren't going to be able to provide these surgeries, they don't get to trade those surgeries to who they want to have them, their buddy Fred, who they golf with. They, you know, we have to get those times into the system to get the orthopedic wait list down, because, you know, in many other areas, we're doing very well in Nova Scotia in terms of wait times. With the investment in radiation therapy, you know, we're going to meet benchmarks. We're already doing quite well in a number of areas, but it will improve. But orthopedics, I don't, you know, I can't run away from the numbers. They are what they are. I met with the Capital District Health Authority Board earlier this year, and I was very blunt. I said, this has to, I need to understand why you're not able to get these wait times down. And I expect that they have to come down, and I want a plan that will get us there. And they were very good, you know, they were very good. They have put together a plan, and I will continue to monitor that plan very closely, because we're dead serious, you know, that we need to provide more effective access to treatment for people with orthopedic needs. Yeah.
The honourable member for Argyll.
Thank you very much, Mr. Chair, and thank you very much, Minister, for that. You know, it was, I understand the challenge, because I spent 3 years trying to figure it out as well. And, you know, every time that you felt that you really were making a gain, another thing came up that really pushed it back another 2 steps. The added point is that when you take a district like South Shore or Southwest, who don't have the orthopedic programs that they have to depend on Valley, of course, for their services. You know, Valley doesn't have the assessment clinic at this point. So I'm hoping that as we learn the things here in Capital, that service can be rolled out to Pictou, to the Valley, and to Cape Breton as well, because I think there's a definite value in it. The prehab teams, absolutely. I mean, I don't know how many constituents I've heard from over the last 7 years that said, geez, I was on the stretcher. I was ready for my surgery. I had taken my 3 weeks off or whatever it was that they had to do to prepare themselves for. I got there, I was hooked up. Some of them were even in the emergency, were in the ORs and had to be wheeled out because something else came up. And anything we can do to reduce that will create an efficiency within the system, because all that time would have been taken up by getting that person prepared. And the OR system as well was one that, you know, I believed in as well. So I'm hoping that, you know, we'll see added investment there to better utilize the resources that we have. You know, it never made sense to me that you had an overload here in Halifax at either the infirmary site or at the VG site, and you had nobody in Windsor, or you had nobody operating in Bridgewater. Like, I mean, everything's within that relative 1 hour area that from a travel standpoint wouldn't have made much of a difference. But had you used a specific OR for 2 hours, that's 2 hours more of OR time that we wouldn't have had otherwise. Yeah, there's dollars attached to it, but I think we're paying for it in another way. So it's good to hear that some of those things are ongoing, and of course I wish you the best, and if anything else that we can do to help out with that one, I know that we'll try to provide it as well. But it's not a simple issue, just like every other issue that you have to deal with on a daily basis. I want to change to physician seats for a minute, because I know the member for Halifax. Why do I mess that up? I always continually, Clayton Park and Fairview to me are sort of so close. They're close, but they're close. You have to sort of drive through Fairview to get to Clayton Park. And the issue of physician seats, and I heard the number of 86, and I'm trying to go back to my discussions with the dean of the day, Dr. Cook. And if I remember correctly, when we basically made the deal with the Liberals to bring in those extra seats, and I give them full credit for pushing the government of the day, there was 20 seats that we needed to work. Now, there were sort of 2 groups of seats, if I remember correctly. One of them was basically out of the New Brunswick seats, so existing seats that are here that we were able to glean because of one reason or other. And then there was an expansion of 10 seats. And because the facility is such in the Killam building at Dalhousie University that they could probably accommodate 100 students total without dramatic change to their facility. So, and I don't remember my numbers exactly. I don't have my briefing book from 2 years ago. But if I remember correctly, it was a number that should have been more than 86. I don't think it was the full 100 that I had committed to, but there should have been. It should be closer to 90, 92, and then a few seats out of the regular core of seats that would have been there already. So I'm just wondering if a little further clarification on that, given some of my recollection on that discussion with Dalhousie University at the time.
The Honourable Minister for Health.
Thank you very much. And we're going to have to get information out of the department that we don't have that goes back further than last year, essentially. But I just say again to the honourable member what I said to the member from Halifax Clayton Park, that we are continuing to fund the same number of seats at the medical school that we have funded all along. There will be some reduction in funding because we discovered that there was some double funding coming through, and I recognize that there's probably a little bonus that the medical school had for a while that they're not going to have, but I think that the important point is that we need to be clear that we are committed to seeing there were seats added, and those seats have gone from being undergraduate students now to being residents, and the money continues to follow those students along. So there have been no cuts to that cohort of people who were added. And additionally, we continue to have the same number of people coming in to the system as we've always funded in terms of the number of people at the system. But we will get some background information to go back a bit. I think one of the difficulties, and speaking frankly, I've had in understanding this, and perhaps other people, the deputy being new, there wasn't a lot written down about what was being provided. And so, without really a clear paper trail, it was very hard for us. And many, as you know, I mean, you went into the department as minister, you probably encountered the same thing on items. Decisions get made, and they're implemented, and the paperwork is intended perhaps to be done later, and because of all of the other things that go on, it never gets done. And unless you have an institutional memory on everything, and I think, frankly, the portfolio of this department has gone from $1.8 billion to $3.6 billion. So even the best institutional memory on the planet is not going to know what that is unless everything is really clearly documented.
The honourable member for Argyll.
Thank you very much, and I appreciate that. And to be frank, I have trouble keeping my bank account balanced. So I can only imagine what kind of work that is. And I'll be up front right here. I don't owe any bills. I didn't take any money from anybody. Blah blah blah. They'll take my money is what they're going to do. Look out. Mr. Speaker, Mr. Chair, the last question I'll ask is this will probably take it up anyway. We'll come to DHA funding, and like I said, you have a very capable deputy minister, one who spent a considerable amount of time in the DHAs, one that understands the challenge of providing a business plan on time to be considered. And the absolute bane of my existence during my time as Minister of Health was trying to bring in those damn business plans on time. And every time that you seemed to be getting closer, boom, it was October, boom, it was November, and you were really working on your new business plans for the next year. So I'm just wondering what sage advice that you're going to be giving the DHAs to make sure that their business plans are available and on time and approved. because now that I sit over here, I can actually ask the question just like you guys did when we were in government, and I know the Liberals will be asking the same very question. So business plans and DHA budgets on time, how are we going to get that to happen?
The Honourable Minister for Health.
Thank you very much, Mr. Chair. Well, the first thing I want to say to the honourable member, and I'm really glad he did raise the DHAs in the brief time that we have left. You know, so the Department of Health's budget is $3.6 million or billion dollars now. DHA budgets make up $1.5 billion of that, so it's 43% of the Department of Health's budget is DHA budgets. And that, you know, it's obvious why that would be. It's because they operate the big acute care, the tertiary care, the Queen Elizabeth, all of the regional hospitals, all of the small community hospitals. They are the places where drugs are bought for people who are in those facilities, and in terms of, you know, some other transplant recipients often get their drugs in the DHAs, and they have many other programs and services. We've devolved to the DHAs the coordinators for continuing care, for example, and eventually long-term care. Continuing care is going to be in the DHAs, hopefully in the not too distant future. Mental health services are in the DHAs, as well as addiction services, primary health care services, and public health and care coordination. So they are very significant players in the delivery of health care in the province, and you know, and they consume a lot of the resources. I have had the opportunity to tour many of the DHAs, not all of them. I'm still working on that. And I've been very much impressed at the work that goes on in the DHAs. Now, the member makes reference to the draft plans or the business plans and the difficulty of getting approval for business plans. I want the member to know that we in the department have received all of the draft plans from the DHAs for this year. Many are in the final stages of being approved, and we are working very, very diligently to bring the budgets, the DHA
Order, please. The
budgets.
time allotted on supply for the Progressive Conservative Party has expired. I will now recognize the honourable member for Halifax Clayton Park.
Thank you very much, Mr. Chair. And there will be many, many more hours to pursue those thoughts. So I'm sure the member from Argyle will come back to it. I had left you with a question at the end that talking about seniors and money that's been allocated for seniors projects and improvements. One was in your platform, $1.8 million for self-managed care, and also the personal alert program. I was asking if you could split them up and let me know relatively how much was allocated for each one. And again, are those two items both to be found in the caregiver allowance line in the budget?
The Honourable Minister for Health.
Thank you very much, Mr. Chair. And to the honourable member from Halifax Clayton Park, the campaign promise that we made indeed was for personal care allowances, self-managed care, and personal devices, safety alert devices. 1.8 was the estimate that we had given for that item. We hadn't broken it down into, you know, an allotment for either one of those things. And as we prepared our budget, we just went through all of the commitments that we had made for this current year, the costing that we had done for them, and we added them into our budget planning process. And so that 1.8 has been rolled into the caregiver's allowance, and is why you see an increase. But in terms of how it will be apportioned as those programs are developed, I can't tell you at this stage.
The honourable member for Halifax, Clayton Park.
Yeah. Just to absolutely be confirmed, it is 1.8 million that you've added to that budget. It's gone up to over 4 million, but there was underspent portion last year. Maybe you're carrying that forward, am I right?
The honourable minister for Health.
It's a projected, there is a projected utilization increase reflected there of 300,000 with respect to caregivers.
The honourable member for Clayton Park.
Thank you. And I only have a couple of minutes, but I'd like to touch on the diagnostic equipment and that line item on 3.16, page 3.16. And you certainly had talked about the new digital mammography machines. I think that's a great thing to have coming. We are a province where we had, I know we're aiming to have some of the highest, if not the highest, utilization of women receiving digital mammograms at the right time. It's not always annually, but to make sure that they are being screened on a regular basis depending on your age. So I wonder if you could say again what the plan is for where those are going to go and the amount of money allocated for the digital mammography.
The honourable minister for Health.
Thank you very much, Mr. Chair. I think the first thing I would say is that the actual digital mammography equipment, the new additional machines, are coming out of the 09-10 equipment budget. They were actually part of the capital equipment we had for this year, yet to be spent. But we went through a process of identifying what were the equipment needs and priorities, and a decision was made that this would then bring the, there wouldn't be an inequity in the services around the various breast screening clinics around the province. So this would bring us completely up to date. I think we would probably be the most up to date screening program, certainly in the Atlantic region, and perhaps we'd be far ahead of other provinces, smaller provinces such as our own. The units are going to Bridgewater, Truro, New Glasgow, Amherst, and Antigonish. And Capital Health have bought their own. They did that large fundraiser, Bust a Move, yes, and they were able to get their own. And this is, you know, this in many respects is a no-brainer, and it is a significant, I mean, it's a significant investment in capital equipment, but it's also a significant investment in health, in women's health. And I'm really delighted that we were able to do this. I know that the capital equipment needs are great, and there's always a next generation of diagnostic tools coming forward. I'm being given the sign that it's time
Thank you.
to
Order, please.
adjourn.
Thank you, Honourable Minister. The time allotted for debate in Committee and Supply has now expired. I will now recognize the Government House Leader.
Mr. Chair, I wish you to now rise and to report progress.
Thank you. Is it agreed? Motion is carried. We will now take a short pause as the minister and his staff will exit the chamber, and we will go to the Speaker's chair. Thank you.
Order, please. The chairman of the Supply Committee reports.
That the committee's made progress and begs leave to sit again.
Carried. The chair now recognizes the Honourable, the Government House Leader.
Thank you, Mr. Speaker. Mr. Speaker, that concludes the government's business for today. We will meet tomorrow between the hours of 9 a.m. to 3 p.m. with the business of the day is supply.
Thank you.
We should now rise, Mr. Speaker.
Motion before the House is for the House to now rise and meet again tomorrow at 9 a.m. Is the House ready for the question? Question has been called. All those in favour of the motion, please say aye. Against? Motion carried. The House stands adjourned until 9 a.m. tomorrow morning. We have arrived at the moment of interruption. This evening's late debate has been submitted by the honourable member from Annapolis. The resolution to be debated this evening, therefore, to be resolved that the NDP graduate tax credit will have little impact on retention rates in the province and does nothing to help low-income Nova Scotians gain access to post-secondary education. The honourable member for Bedford Birch Cove.
Thank you, Mr. Speaker. The NDP's graduate tax credit is a measure that they campaigned on, and I will give them credit because they've kept this election promise, unlike so many of the others that have been broken since they've taken office. And they should take credit for that. They did promise this tax credit, and they have delivered it. And we actually thought it was a good idea. In fact, we campaigned on it the penultimate election. We thought it was a good idea back then, but since then we've done some investigation on it, and we dropped it because it's not a good idea. New Brunswick and Manitoba have instituted similar programs, and they